So I just want to say that I'm particularly pleased with the Hemophilia Council's focus on highlighting the impact of the pandemic on one's mental well-being, because it really shows that this group gets it. They get the connection between physical health conditions and mental health. And there couldn't be a better time to raise awareness, because May is Mental Health Awareness Month. So you all are doing the right thing at the right time. And thank you for including me. So I want to set the stage for a few moments. First, I'm a psychologist by training, and I've worked in the public mental health system in California and in Wisconsin. However, I'm not an expert in navigating health plans and the Medi-Cal system, but I will share resources with you today created by experts in these areas. So I'm going to present for several minutes and then leave time for any questions you might have. And if I don't know the answer, I'm happy to research the answer and get information back to you and follow up with the really great colleagues here at the council. So please know that that's my commitment. And then second, throughout this presentation, you're going to hear me use the term behavioral health disorders. So what is this? Simply, it means mental health disorders like depression or anxiety. And it also includes substance use disorders like alcoholism or drug addiction and use. The goal at the end of the day, the goal is for everyone to have positive behavioral health or mental well-being, to be in a really good, healthy space. And if you're not, to be able to know the resources to seek to get to that healthy space indeed. So many of you probably already know this, but I wouldn't be a psychologist if I didn't provide this basic information. But for those who aren't aware, these are some common signs and symptoms of mental distress or crises. Feeling sad or down, feeling confused, or having this reduced ability to concentrate, having excessive fears or worries, or extreme feelings of guilt, extreme mood changes, highs and lows that are pretty dramatic, and withdrawing from friends or activities that an individual would normally be engaging with. And also significant tiredness, sluggishness, not getting out of bed, and then having low energy or problems sleeping that aren't typical for an individual. Now, we all have moments like this. We all get the blues. We all have times when it's just not going well. And if you have a chronic health condition, then you're definitely having moments that you're dealing with that. But these are just some signs that if things are out of the ordinary, that you should pay attention to, and particularly if there's multiple things happening at the same time. So very basic, but still important. These are not symptoms to ignore, because over time, if you do, these can really lead to some poor health outcomes. So pay attention to what's happening with you and what's happening in your family and your community members around you. And the truth is, according to research, that there are many things that impact one's mental well-being. So this includes having a chronic condition or a physical health condition that's not even chronic. Research tells us that there's an intersection between physical conditions and behavioral health conditions. That's really important, because those who have chronic health conditions are more susceptible to a mental health condition or a substance use disorder. And they may end up seeking care in emergency situations when things have just gotten too intolerable. And they may go to the ER, or they may have high rates of hospitalizations. And this is not ideal. This is not where we want people to get their care. We want people to be able to have preventative coping skills, and also to just know the resources and where to go if something pops up. So when we look at kind of the national statistics overall, and specifically for racially and ethnically diverse populations, we know that these groups in particular experience less access to mental health services. They're less likely to receive the care they need. And that means that they're getting poor quality care even when they are getting treatment. And we know that this impacts help-seeking behavior. So they may delay or fail to seek mental health or behavioral health treatment. And when we talk in particular about African American or Blacks, they're more likely to terminate treatment prematurely, and after an entering care, less likely to receive the best available treatments for example, depression and anxiety. So this is problematic. In general, people that may have a chronic condition and a mental health disorder are experiencing these kind of health disparities. But when you represent a ethnically or racially diverse group, you have kind of this added layer. And so that's why we really want to pay attention to what's going on with you early on so you can get the help that you need. All right. And stigma is really, really important here. So stay with me for a moment on this, because there's a reason why this happens. And we have to be honest that many communities are hesitant about seeking behavioral health treatment because of some of the historical atrocities that have been enacted by Western medical system on disenfranchised communities. And this would include things like experimentation without consent that have resulted in irreversible damage to someone's health, and in some instances, death. This is a really big deal, and we can't overlook what's happened. That doesn't mean that we can't move forward, but in order to do so, we have to address that there have been some really rotten things that have happened to many communities, which has impacted their help-seeking behavior. And in turn, these messages have about mistrust of the healthcare system have behavioral health impacts. And it gets passed down from generation to generation to generation. And as a member of a community that has aspects that are disenfranchised, African-American community, I've seen this in my community members. I've seen this in the clients that I've worked with and the communities that I've worked within, that messages get passed on that we adopt and hold on to and don't serve us well. So that's why it's important. And that's why I put in this information about stigma, mistrust, and in particularly how it impacts racially and ethnically diverse communities. Now, during the pandemic, we have continued to see this amplified as many diverse communities have demonstrated hesitancy to taking the vaccine, which has resulted in a high transmission rates and death rates, not just among patients, but also among healthcare professionals. So my father-in-law, he sits on a hospital system board. And when they looked at their rates of employees, healthcare employees refusing the vaccine, almost 50% of staff that initially refused it were Black and Latino, which again is kind of a nod to this kind of historical mistrust of the system, the stigma, these messages that get passed on. So now you've heard about kind of the connection of chronic health conditions and behavioral health, and I've kind of touched on racially and ethnically diverse communities and how they're adversely impacted. So what now? Where do you look if you need help? If you've thought, okay, I get it. There's something going on. That screen earlier that had the faces and the indicators. I think that something's going on with me or a family member. What do I do? How do I seek the help? So I'm going to try to, for the remainder of this presentation, share a little bit about resources.
Thank you, Dr. Clark-Harvey. Wanted to let folks know that we do have a couple of webinars coming up in the coming months. In June, we're going to be talking about telehealth. In July, we're going to be discussing, how you manage with managed care in California. And then we're going to be talking about the roadmap to keeping yourself insured in August. So, some of those questions even that folks had about what to do about insurance, we may be addressing in additional upcoming webinars. And so I want to thank our webinar series sponsors, and we appreciate their support in making this possible. And I thank all of you guys for joining us today. Thank you so much, Leandra, for being with us and for your presentation and all this great information. And we look forward to seeing everyone next month. Thank you. Thank you all for joining us. Bye-bye.